Now I'd like to request Professor Mohan Isaac to moderate the scientific sessions. Before Sir does that, let me take this honor of introducing Dr. Mohan Isaac Sir. Dr. Mohan Isaac Sir is currently Clinical Professor of Psychiatry, Division of Psychiatry, Faculty of Health and Medical Sciences, the University of Western Australia, Perth, Australia, and Consultant Psychiatrist, Fremantle Hospital, Fremantle, Australia. Sir was formerly Professor and Head, Department of Psychiatry, NIMHANS, Bangalore, where he is now Visiting Professor. He is also Adjunct Faculty of Psychiatry, JSS Medical College, JSS Academy of Higher Education and Research. Sir was formerly Temporary Advisor, Short-Term Consultant, and Short-Term Professional Staff, Division of Mental Health, World Health Organization, Geneva. Sir has involved in the development and implementation of India's National Mental Health Program for last 30 years. It is a matter of great honor having you with us, sir. And thank you very much for accepting our invite and joining us for this entire symposia of 2 days. And as I learned in last few days of my interaction with Professor Isaac, sir, he is a meticulous thinker, a critical evaluator, and a great teacher. I welcome you to this particular symposia, and I request you to kindly take over and handle the further proceedings. Thank you very much.
Thank you, Dr. Praveen Kulkarni, Dr. B. Suresh, Pro-Chancellor, Dr. Surinder Singh, Vice Chancellor, Dr. Manjunath, Registrar, Colonel Dayananda, Superintendent, and Dr. Basana Gaudapati, Dr. T.S.S. Rao, Dr. Rajesh Raman, Head of the Department of Psychiatry, and all the distinguished resource persons. I will, before we formally start the program, I would like to make some observations. The first observation is that I have personally known T.S.S. Rao, Rajesh Raman, and Kishor for a number of years. But I have learned one thing today, and that is how frequently each of them smile. I think on the one end is T.S.S. Rao, who himself agreed he laughs, smiles all the time, which I can agree. Rajesh Raman, I have also known for a long time, almost from the time he was a student, I think, in JSS Medical College, doing MD, and then, of course, various steps, and now he is head of the department. He's also probably rightly said he smiles only once in 15 days. I think he was a little harsh to himself. I think he smiles more often than that, but he was just driving home a point. And Kishore is somebody whom I don't see often, but I am on the telephone for various things. So the first thing I learned is how frequently they smile in the department, which according to their own statements, I have understood. Now the second point I want to make is that I am very envious of all these three people. T.S.S. Rao, who was the former head of the department, Rajesh Raman, who is the current head, and Kishor, who is an associate professor. Now you might wonder why I am envious. I am envious because they work in a department, an institution, where they have such excellent support for any innovative program they start. I worked for a number of years, more than 30 years in NIMHANS, to get the Vice Chancellor, that is our director is also Vice Chancellor, get the registrar, get the medical superintendent, etc. for a program. It's an enormous task. You know, somebody is busy, somebody is not there. I find that all the dignitaries, all the top persons are there in this program. And this is not a very big program. I mean, this is a symposium on mental health, making all the other non-mental health professionals, facilitators in the mental health. One, it may be the times that we are talking about. All the speakers have till now talked about, the difficult times that we are in. But I'm very envious that all these higher-ups, the Pro-Chancellor, the Vice-Chancellor, the Registrar, the Dean, and the Superintendent, they are all very supportive. They have made very meaningful comments about this. And such encouragement, I do not think, I mean, there are now a number of medical colleges here. I have familiarity with not all of them, but many of them. I would not find this kind of support for a mental health program. In fact, there are young colleagues who say, when I go to the dean, he says, no, don't bring with some more things. Why mental health? It's only a small portion of the curriculum. But this is tremendous support. And I'm, indeed very delighted that these people, Dr. Rajesh Raman, Dr. Kishor, and Dr. T.S.S. Rao, have such tremendous support for any new activities. Now, the third point I want to make is, I think the importance of this program has been very rightly highlighted by Dr. Suresh, Dr. Surinder Singh, everybody. In fact, in the process of their brief interventions, as T.S.S. Rao noted, I think they have hit upon the most important things. We heard, the pandemic of fear psychosis. We talked about other environmental problems of migration and reverse migration. We heard about the medical superintendent from his perspective, talking about the isolation which people go through when they get into a COVID ward. Some of them may never see their close relatives again because they go in a different direction. It's the same with the family, close family members. They might, as the superintendent rightly said, if the consequence has been bad, then the relatives may just have a glance of them. So it has been a very difficult period. Also, they talked about the burnout of the medical professionals and the health professionals who work in all these settings. And the Pro Vice Chancellor also told about another problem, and that is the problem which is faced by the whole education sector, starting from the nursery, the kindergarten, to the schools and the college, the higher education. He was talking about the higher education sector where people do not know when their exams are, in what mode their exams are. So it is a kind of, uncertainty. I would call it a kind of malignant uncertainty. For example, in Bangalore today, I think the paper has said something. People are saying, oh, day after tomorrow, the lockdown will clear up. Some people are saying, no, it will not clear up fully. The buses will not run. The auto rickshaws will run. Somebody else is saying, no, auto rickshaws will run. It will be only till 10 o'clock. So this is a period of malignant uncertainty. And uncertainty is something which brings on a lot of anxiety. And here, of course, it's a contagious disease, it's a fear of death, etc., etc. So I think all the people who spoke before me have brought out very, very important aspects of this problem and how important this program is. I just want to quote, before I go on with my introductory remarks, something which many of you might remember. This you would have read in your final year high school or in your pre-university or so. I'm quoting Charles Dickens from A Tale of Two Cities. It was the best of times, it was the worst of times. It was the age of wisdom, it was the age of foolishness. It was the epoch of belief, it was the epoch of incredulity. It was a season of light, it was a season of darkness. It was a spring of hope, it was a winter of despair. I'll tell you why I was reminded of Charles Dickens. I think our times currently, whatever he wrote, he wrote more than a century ago in The Tale of Two Cities, under a different kind of setting. But I think we have opportunities and challenges. I mean, your medical college is coming out with an excellent program. When a lot of people are talking about burnout or we can't do anything, etc., etc., these are times of opportunities and challenges. We don't have to look into the medical, we just read the newspapers and watch the television. On the one hand, is what our superintendent mentioned, people lining up the worst stories, the tragic stories, which is probably what is seen all over in the international media, how bad the things are in India, how things are not very good, etc., etc. But I think the real good news from India is not the COVID deaths and the oxygen shortages, etc. But the large number of very ordinary people doing remarkable things, not for any recognition, not because they will get any money, and many of them without fear of contracting COVID. This is enormous. Unfortunately, the media doesn't give that much of. There's enormous goodwill around. Neighbors helping each other, auto rickshaw drivers driving, taking dead bodies when even the children don't want. There's enormous amount of goodwill. There is remarkable things which very ordinary people are doing. And that is, I think, the good story from our country. Now, I will not take much time before we have a very good panel of people, 3 of them from JSS Medical College. And as Praveen introduced, 2 of them from one, Kiran from Vaidehi and Vinay from Adi Chindingiri. They are all people who are involved in this work. I'll formally introduce them before they start. I just want to also conclude by saying that there are 3 or 4 things that we were not aware of till this COVID pandemic started. One is, of course, the quality of our healthcare. We always read about excellent Apollo hospital chains or the other private hospital chains. The government has been working on health tourism, etc., etc. But the COVID pandemic has given all of us, all the citizens in the country, an understanding of how unequal our healthcare system is, and in certain settings, how poor our health systems are, especially the public healthcare system. I mean, this pandemic, I think, has given us the lessons, and I hope the government will learn the right lessons and in future will invest more money for health, particularly in the public system. Then the other thing that we have learned is, well, of course, we all talk about the income inequality, etc., how unequal our society is as far as the disastrous consequence of this pandemic is concerned. While most of us sitting here are, not too disturbed as far as our personal life is concerned. At least I'm sitting in my house, no problem. I have no fear of food. Things are okay. But the large number of people who are daily wage earners, who are pushcart vendors, I mean, the disastrous consequences lockdowns are bringing in, etc. The inequality of the consequences. And we are now seeing it, the vaccination. There's a debate going on in the country. I mean, if you have money, you can manage to get a vaccine, get the first jab. I'm not going into the details, but what we are beginning to learn is that our society is a very unequal society. We knew that there were people, extremely rich people like Anil Ambani and Mukesh Ambani and all that, and close to them, within their eyesight, there were the slum dwellers and the footpath dwellers. That is one aspect of, but then we were a happy country. We were a fairly resilient country. Dr. Rajesh Raman mentioned that we don't have much research on well-being and resilience, etc. But we have been a very resilient country by and large, in spite of this is my personal belief. But today, with the COVID consequences, we are learning the qualitative dimensions of that inequality. The third point I want to mention is the mental health pandemic. The COVID pandemic, as the Pro-Chancellor very rightly said, will sooner or later come down. In fact, the intensity of the second wave is already coming down. The third wave may be there, may not be there, maybe it is there, we should be prepared, etc. But ultimately, it will all come down. Even the Spanish flu of a century ago lasted only 2 years. We have already finished 1 year and 2 or 3 months. It will come down. But what about the mental health consequences? It has only begun. It is a pandemic by itself, and it will last for very, very long time. People who have lost loved ones untimely, unexpectedly, who are not able to grieve for them in the proper way because the Bangalore City Corporation took over the, we read in the paper that the final rites are conducted for 1,000 people by the minister. It's a state responsibility. So the large number of people who have faced loss and grief and depression, etc., the consequences of mental health will continue. Some of the speakers will talk about the disaster consequences, etc. So that is the third point. And the fourth point is, again, some of the previous speakers have talked about the mental health of the health professional itself. In fact, we have read here and there about suicide. At least I remember reading somewhere in North, I don't know whether it's All India Institute of Medical Sciences, also one of the junior doctors committing suicide because of this related stress. So the enormous stress which not only healthcare professionals, but all the frontline workers, the police and the various other people, that is a problem, and the resultant burnout is a problem. So with all these introductory comments, I would like to now open the seminar. What I would like to say is that there are going to be 5 talks, 3 of them today and 2 of them tomorrow. I know that a lot of people have logged into the Zoom, and a lot of people would be attending the live streaming. All those who are registered, please note that you can raise a question. I mean, on the Zoom, you can ask your question on the chat box, but please do identify yourself, because many times when the things come on the chat, it is a Samsung M31. You don't know who the person is. Please identify by your name and by your discipline. Are you in the dental college? Are you in the pharmacy college? Are you in the physiotherapy course, etc.? This is just for our understanding about how many people are attending, what kind of background they have, etc. We will try and answer all the questions. If the time doesn't permit, of course, we'll put them together and we'll request the distinguished panelist speakers to answer the questions. To break the monotony of a long lecture of 35 to 40 minutes, at the end of 15-20 minutes, the speakers themselves will decide when to break, and we'll have a 5 to 8 minutes of discussion. You can put your questions on the chat box, and then we will respond. Or if somebody wants to, make his presence felt, and you want to raise your hand, and then somebody will unmute you, and you can talk. So we want to make it interactive, not just a didactic, 3-hour sessions where people come and talk for 40 minutes, etc., etc. So that is the second point. And of course, the organizers of this program will send you on a Google form to just evaluate. The evaluation is not of the participants. Evaluation is of the program. In fact, all the distinguished speakers said that if this is good, we will watch it. We would make these kinds of things available to other people. The Pro-Chancellor even said that there should be documentation of everything. So please, all the registered participants, please, fill up the forms and send it back in a timely fashion. So these are some of the ground rules for this session. Please remember, the whole thing doesn't end today. There will be only 3 presentations today, and the 2 will be tomorrow. We want all of you to attend, not only just today, but also tomorrow. So the overall goal of this program is to make people who are participating understand the problems of this. We call this a disaster. It's a kind of a disaster. In fact, people who have written about it says that the effects of this disaster has been cataclysmic. In fact, when I first read about it in a journal, I didn't know the correct meaning of cataclysmic. I'm not going to say it. All of you check what the meaning is, and then you will know. Then you will understand the effects of COVID-19 all over the world has been cataclysmic. So the effort is here too. And some people, Praveen, I think, mentioned that we don't have enough mental health resources. The mental health problems are enormous. So we have to have a large workforce at various levels to deal with this problem. Some at the gatekeeper level, some who are facilitators. Our superintendent told us that, he would want the nurses to know who are the people who should be referred to a counselor, who are the people who should be referred to the psychiatrist. If everybody has to be referred to psychiatrists and, clinical psychologists, we just don't have enough of them. And even the ones who are there are working only in Bangalore, Mysuru, and Hubli, not all over. Whereas and many of you who are now getting trained and who will later on go and work in many places can be mental health facilitators. And the whole purpose of this program is to give you an exposure to some of this. And of course, there'll be references for learning more, etc. You're not going to become mental health experts or expert counselors by this 5-hour, 5-lecture thing, but you will become more sensitive. Mental health is a very stigmatizing problem. Most of us don't want to even talk about it. So this is a kind of an exposure symposium to sensitize you to mental health problems, which many of you would have already got sensitized to. Because in each one's family, there would be somebody who would have faced COVID upfront, and they would have been maybe losses, etc. And so that is the purpose of this. So I would stop here, and I will now introduce the first speaker, who, in a way, to an audience of JSS Academy, needs no introduction. But still, I would introduce him. He is Dr. Kishor. Kishor Manohar Rao is the Associate Professor in the Department of Psychiatry at the JSS Medical College. I knew him first when he came for an early career psychiatrist leadership course many years ago to Nimhans, I think soon after he finished his MD. This is a program which we have been holding. It is under a foundation called the Ramchandra and Murthy Foundation, where 16 people, 16 early career psychiatrists are selected and trained. So he came, and that is when I first got to know him. He is an invited guest faculty at the Faculty of Medicine, the AIMT University in Malaysia. He was a JSS a delegate to the JSS University, delegate to Mayo Clinic. He organized the first national conference on combat depression. He is currently, as TSS Rao mentioned earlier, chair of the Indian Psychiatric Society's Faculty Training Task Force. And I have been interacting with him on a number of projects, and it has been a great pleasure to do that. And now it is my great pleasure to invite him to make the first presentation in the series of 5 presentations. And the first presentation is on understanding disasters and the psychological impact. He is like the opening batsman. We don't have 11 batsmen. 11, even in a cricket match, it is the first 3 or 4 who are the real batsmen. So Kishor is the opening batsman, and we have 4 more to follow. So welcome, Kishor. Open to you for your presentation.
Thank you so much, sir, for the introduction. I will share my slides, and in the next few minutes, I'm going to take you across the first session on uh, understanding disaster and the psychological impact. Now, in this session, what we want to convey is about what is a disaster and what do we know about the type, and then the impact of the disaster on the mankind. We are going to discuss the normal reactions and why we call certain things as disorder. Then, what do we know about mental health disorders in India so far? And I'm going to talk about on the economy, how much it costs, and how common are psychological conditions in disaster, and what is so unique about psychological conditions during COVID-19 pandemic, and some case witnesses to understand how it presents. So, at the end of this presentation, as a mental health facilitators, these are some of the things we expect to know, and I'm going to take you through one at a time. Now, what does this disaster means? And World Health Organization is probably the best in giving a very nice description, because unless we understand disaster, we will not be able to understand how big the problem is and what kind of issues come up. So, the World Health Organization mentions that a disaster as a major problem occurring over a short or a long period. Short in case of tsunami, long period like the one we are going to have now, the pandemic, that causes widespread human material, economic, and environmental loss, which exceeds the ability of the affected community or society to cope up using its own resources. So, when we look at this definition, we understand when our resources dry out to cope up, and it is so big, either in a short span or in a long span, involving many components of our existence, that is the time we call it as disaster. And disasters are usually classified as natural, that's earthquakes, tsunamis, cyclones, floods, and then there is something which is man made, and they are subsequently classified as nuclear, biological, and chemical. Now, you might have heard about Bhopal gas tragedy, and which comes under the chemical. And you might have also heard about the government of India notifying under the National Disaster Management Authority that the pandemic H1N1, COVID-19 are all considered as a biological uh, disaster. Now, why is that important and what impact does it has? The World Health Organization says the most important impact of a disaster, it is the people who matter most, and without people we have no disaster. And this whole program has been to understand what kind of impact it has on the humans and why it is important to understand the impact. Now, disaster threatens the survival of mankind. In the evolution, whenever there is a threat to the survival, automatically we start to think, we start to do something to overcome and take up the challenge. Now, what will happen with the disaster is that people, there is a major change in the way they start to react, and the whole thing about mental health is disrupted. Now, what happens? Usually, there are cognitive changes, the way we people think, there are emotional changes, the way people feel, and there are behavioral changes, the way people act. And aptly, we have to understand that there cannot be health without mental health. So, when we look at these components on which the disaster is affecting, we have to understand in humans certain aspects might be predominant than the others. But the question everybody is concerned about, what is a normal reaction and what is a mental health disorder? And the five sessions which we are holding will take you through this concept to understand what is a mental health disorder and what are mental health reactions to the event. Now everybody knows that when there is a disaster, there's a fear. People feel sad. They might lose interest in what they have been having earlier. They might lose appetite. They feel that it's difficult to fall asleep. They might find it difficult to concentrate. Many people are very angry, upset, irritable. Some become suspicious. Why this has happened to us? So these are considered normal reaction. However, when we say about mental health disorders, the reactions when they are severe and they are persistent for a long duration and they disrupt an individual's social and occupational roles, then we give the nomenclature mental health disorder. So, sadness is different from depression, anxiety is different from general anxiety disorder, use of alcohol and cigarette is different from having substance use disorder. Now, how do we say that this is a disorder? To make it easier for us to comprehend, the World Health Organization comes out with an international classification of disorders for all condition, not just for mental health, whether it is pneumonia, whether it is malaria. There are certain disorders under which we have to understand the concept, and most of the time in India, all people follow the World Health Organization International Classification of Diseases and Disorders, and we diagnose the condition based on these concepts. But the question we have to answer is that why it is necessary to understand the psychological disorders? Do people in India have great concern about psychiatric disorders? What was the status even before the pandemic? Now, a document in 2019 December, just before the onset of COVID-19, came up by Government of India, Indian Council of Medical Research, and WHO. Together, they came out with a paper. How many in India have mental health disorder? Nearly 20 crore people had a diagnosable mental health disorder, out of which 4.5 crores had depressive disorder, around 4.4 crore people had anxiety disorder, and the statement the paper made is 1 in 7 Indians had a severe impact on the mind, and many of these people were now having a serious mental health disorder ranging from minor to major. So when we talk about the psychological disorders in the context of pandemic, we should understand even before we look into the impact of pandemic, there was a existent huge number of people who had mental health disorders. That is most important for us to understand. When we talk about mental health disorder, obviously people ask what happens to the economy, how much it costs if we do not treat them, how much impact it has on the life and the welfare of the country. So in 2020, the World Health Organization came out with the document on the economical impact of mental health disorders. So it said that, so this is the calculation they did just at the first wave. They said that $16 trillion is the economic output lost when people with mental health disorders are not addressed. They mentioned that it has a great concern for public health, also for economic development and societal welfare. So when we talk about the mental health condition, it's enormous amount of money which goes into the drain when we do not address it. Now, is there a information on India how much it cost when we do not address mental health condition? Before pandemic, the estimate for 2012 to 2030, nearly a span of 12 years or so, 1.3 million trillion dollars was the impact they estimated because of mental health conditions. So we need to understand when all of the dignitaries said how much impact it has on the students, on the healthcare system, on the education, on the society, on the marginalized section of the people, those workers, laborers, and information technology people. It's phenomenal impact on the economy. Now, considering all these things, when we consider a disaster, do people have psychological issues? If so, what? So, some of the information from India has come from the Bhopal gas disaster. I think Professor Mohan Isaac was also there when this happened, when they looked into the people and they saw that nearly one third of these people had anxiety, depression, and adjustment disorders. Now, we all know that in certain parts of India, earthquakes are common, and people have simultaneously tried to look at how much impact it has. Whenever there has been a earthquake, let's say in the Gujarat region, they saw that 59% of the people had psychological issues, post traumatic stress disorder, which is a very difficult condition where people relive those moments again and again. Nearly one fifth of them had post traumatic stress disorder. Depression was seen in nearly one fourth of these people. And as recently as in tsunami, which happened in the southern India, 25 to 30% of the people developed psychological condition. So we get to know that the psychological impact whenever there is a disaster has been a good numbers, which has ranged from one fifth to one fourth of the population are seriously affected. Now, what is this uh, different in this particular disaster? We all know COVID-19 pandemic is a unprecedented in the recent times. We never thought about this and we were obviously not prepared, and the course has been unpredictable. Everybody assumed that things were okay after first wave. Now we are already going through a terrible second wave which is receding. We are preparing for the third wave. In some countries it's a fourth. So COVID-19 pandemic is such an unpredictable course and it causes huge number of people who are severely affected. Most of you are very much aware in everyday newspaper we know that more than 3 crore positive cases have been reported. There are more than 3,50,000 deaths in India. World over, more than 17 crore people have been affected with more than 37 lakh 50,000 people's death. So, when we talk about who is going to support the mental health, we have to understand that there is only zero point 0.4 psychiatrists per lakh population in India. And as a health professional, whether you are in different domains of healthcare, your role to help your family members, your neighborhood, your colleagues, your students, your patients, family members of those patients, your role as a mental health facilitator is immense. And this whole program is designed to ensure that you are enriched by the end of these presentations. Now, how common are psychological disasters in this pandemic? So when the pandemic started, people looked at the general population, not those who came to the hospital or the family members. Nearly 20 to 40% of the people in the general population developed anxiety and depression. And some of these people, nearly one third of them developed headaches. They had throat pain, which was not related to COVID. Many of them felt very tired. They spoke about fatigueness. They could not carry out the work they enjoyed previously. Nearly one third of these people had lethargy, and a good number of suicide reports have been coming up in the press and the media, which everybody knows. Now, this common psychological conditions, something are very unique in this pandemic. Many started to have disturbed sleep. I think you would have heard since the time of pandemic, many could not have peaceful sleep concerning about what is going around them. When the concept of well-being was considered good health, good work, and good feel, 70% reported that they have poor well-being. Many of them, even though they never had a primary contact, they became suspicious whether they have COVID-19. Almost the numbers are 37%, and big number of people started to use more alcohol, started to smoke more. So there was increase in the use of alcohol and nicotine, and many of them developed disorders related to this, 25 to 30%. Even today morning, we had a person admitted in cardiac center with severe withdrawal symptom. He's in a delirious state, and in the last 2 to 3 months, he has been taking large amount of alcohol. Many people have reported sexual disorders. They do not have the normal sexual relationship, and they are greatly concerned about them. There has been phenomenal increase in gambling behavior. Children's, adolescents, they are spending hundreds and thousands of rupees in online gambling, and it has increased by 50% in this period. So, and I hope all of you know that pathological grief, what we see, a reaction to extraordinary circumstance of death, not able to get the consolement for the death of the near and dear ones. There are no rituals to carry out to allow the person to grieve, and people are extremely disturbed. So there has been lot of information about grief and pathological grief. These are some of the things which happened in the community. But what happened to the poor people who are affected with COVID? Very interestingly, many patients with COVID became confused, what we call delirium. Some of them developed psychotic symptom. They became suspicious. They began to feel that something has been deliberately done. Many people with COVID developed depression. They were isolated. They were in quarantine. They were hospitalized. Many developed anxiety with palpitation, difficulty to breathe, and lot of uneasiness all the time. They had difficulty in sleeping. COVID patients have been complaining more and more about tiredness. They are not able to work as they were before. They are talking about forgetfulness. They can't remember since the time they have been affected. And most of these people are also talking about they can't taste or smell as they did before. One of the person who has been constantly taking our help, he says that my whole sense of s- taste of taking food has gone. I'm not able to enjoy any food from the time I've been affected, even though I was never admitted. Many people feel that the moment they were pushed, they were in the hospital, in the ICU, in the other centers, they felt that the suffocation and of a kind of impending doom that they might die. And many people with COVID are also contemplating to end their life. And you would have heard that some of these COVID patients have also committed suicide. So, what happens to the general population which were never exposed to COVID infection versus those people who were COVID affected? is something we have to know and see the difference pauses. But why do people with COVID and this disaster have developed so much of psychological condition? First is that we know that COVID-19 infection in the individuals affected affects the brain. So once the COVID affects those individuals, some of the conditions seems to be a direct effect of the infection itself. Many of the medications which were rarely used or not extensively, like steroids, these can also cause lot of psychological condition. And the issue of management when they are taken to the place without family members, without able to see the doctor, not being able to meet their family members, and in that suffocation of wearing the mask, being there, restricted access to everything, the whole treatment concept can cause severe trauma. The isolation, quarantine, and stigma. People, once they get to know that they have COVID, the whole neighborhood, the relatives change their approach. It badly affects the individual. And numerous people have lost their job, they have lost their earning, and it can cause lot of issues in development of mental health condition. Socio-cultural issues like rituals, which are so important for a person who has lost his family, these have been disrupted, and nobody seems to have a daily routine now because there is erratic schedule of work. Most of them are at home, and lot of exposure to press and media seems to have affected us a lot. So these are some of the things which has happened, but as rightly said, not everybody develops mental health condition which is of concern. Resilience and ability to bounce back has been coming up. People are now connected more to each other. They are thinking the impact it has on a life, and they are reframing the life around them. Some people are now choosing better way to access and propagate their business, connecting with the family members through live interaction through online media. Many people are also looking for opportunities to service. So, resilience is also something which has come up in this pandemic. So, with this, I will conclude my first of the presentation. Now, I am open for questions and answers. Sir, over to you.
Thank you, Kishore.
Yes.
You have, of course, initiated the discussion on COVID and its consequences. And, told us what disasters are, what its consequences, what are the different types of disasters are, what are the various symptoms. And you have also helped us to clarify what is just a emotional response or reaction to a disaster and what is a probably little more serious and pathological kind of reaction. Uh, it is open for discussion. As I had initially said that, we don't want lengthy talks, monologues, but we would break at the end of 20 minutes. If there are questions, please feel free to send them into the chat box. We haven't seen many questions. If somebody wants to make a point or ask a question, raise their hands, and then, of course, we will unmute you and you can ask a question. But please feel free to enter in the chat box and we'll come up with those questions. Are there any questions? There have not been many that I have seen in the chat box. I was, in fact, thinking that since all the participants are from various departments and divisions of JSS Academy of Higher Sciences, Higher Education, we will be bombarded with questions. In fact, as we were planning, we were considering what will we do if we have more questions than we can handle and how we will deal with the time. So please feel free to ask any questions. This is the time for you. Are there any questions? Please raise your hands and we will request people who are assisting us to unmute you so that you can ask the question in person. I don't find many questions. Nothing, in spite of our stopping, nobody has put any question in the chat box. Now, there is one question. Sir, thank you very much for your valuable talk. I personally have a question. There is so much inhibition regarding vaccination, not only rural, even urban population is hesitant to get vaccination, uh, vaccinated. How can we make them understand? So I am very happy that I was getting a little upset that there were no questions. But there is a question, and this is a very important question about vaccination, vaccine hesitancy. This is not something that Kishore talked about in his presentation, but still I would request Kishore to quickly respond. This issue might come up even later. We have some more presentations. Open to you, Kishore, to respond to this question.
Yeah, thank you so much for the question. I'll give you one or two example from the mental health conditions which can come in between way of accessing vaccine. I remember a lady who came to us about 4 days back. She said all through her life she has never visited hospitals and she has been extremely concerned with taking injections or any kind of medication. And now she has been forced to go and take a certain injection in the hospital. So she said, "How will I ever do it?" So these people which whom we call as hospital blood injury phobia, there are a small group of patients who seem to be extremely frightened to access any kind of care in the hospital. So one of the best strategies is that wherever they are, the many new schemes have come up. It is about community being accessible to vaccination centers nearby. So one of the best strategy is to make the vaccines available everywhere, not just in hospital. Second, all the community leaders who are important and who are valued in their community, once they start openly talking about that, that is one of the ways to address this. So a community leader, a person from a family, a person who is a colleague, a person who is in neighborhood, once they start talking about it, it becomes easy for the person to take vaccine. So I would request that we need to understand what is the concern of a person who is hesitant to take vaccine so that we can effectively address this. I hope I have answered the question.
Okay, Kishore, people have warmed up. Lot of questions are coming as we anticipated. The
Yeah.
next question is, sir, can I know how COVID-19 affects the memory impairment? There is a related question, and that is about neurocognitive impairments, not just memory, the larger aspects of neurocognitive impairments. Yes, Kishore.
Yeah, thank you so much. Initially, for nearly 6 months, there was no information that COVID affected the brain, but that was very preliminary. By end of November or December 2020, we got to know that in some patients, COVID was able to attack the brain, and many of these patients who had problems with smell, these might be the people who might have been affected by the COVID. I'm hope I'm visible. Yeah. So this
Yes.
might be the people who might have been affecting with the COVID, but later we got to know it disrupts the memory problem, memory conditions in the brain. It causes severe problems in the sleep. Some of these people seem to have some peculiar features, predisposition for more and more tiredness because the brain seemed to be now fogged, secondary to the infection, or it could also be secondary to the some of the medications we have been trying extensively. So there are many reasons, but in the gist, the neurocognitive impairment starts from simple memory functions to complex issues of loss of smell. So I think there is a whole list of neurocognitive impairment which is coming up of late, but whether it is related to a particular variant of the virus, whether it is related to all COVID variants of the virus, at this point we are not sure. But we have been coming across many people who are talking about difficulty in concentrating of late. Yeah.
Okay. There are numerous questions. Uh, One person has asked, this is a positive question. Sir, your presentation was good. What can be the suggestion to the youth to make use of their energy in a good way? This is again not anything specifically touched upon by Kishore, but I think it's a question which, because most of the audience will probably be under the category of youth, and it would be good to answer this. Some of these will come up in the presentations of next people also, but since we have little more time, I'm requesting Kishore to respond to this.
Yeah.
Yes, Kishore.
Youth are playing an important role, and in our data says that nearly 600 million people in India might have access to the internet, and they are young. And this whole program, if more and more youths are part of this program, where we empower them to understand the concept about mental health, they can play a huge role. But out there also in the community, these youngsters are very important, and they seem to be helping many people to understand what COVID-19 is, how to get access to vaccine, how to go and seek treatment when they are affected. I think there is a great role for youth. The simple best way is that wherever right information and right knowledge is accessible, we should encourage you to be part of it. And having a mobile phone can be of great use for empowerment in the time of COVID-19. And if you are part of this program, I think you are definitely in the right place, and you can spread the message across your community of youngsters that there is a positive role we all can play, most so the young population. Yes, sir.
Okay. Now there is a very specific question. If someone already has a pre-existing mental health condition, how can they protect or promote their mental well-being? Of course, during the COVID pandemic.
Yeah,
Yes, Kishore.
that's a very nice question. It's a very vulnerable phase if the person already has a mental health condition. The first and foremost is that please do not lose touch with your treating doctor during the pandemic time. If you are coming across any warning signs or symptom which you feel that is now little more than the earlier period, please get in touch with the treating doctor. Most importantly, if your family members are noticing and they are telling that there seems to be some change which is happening recently of late, it is important for us to access treatment as early as possible. Pandemic is definitely time challenging for those who have already have a existing mental illness. This can be a thing. Something can be specific because, for example, a person with obsessive compulsive disorder, when the whole world is talking about hygiene, repeatedly hand washing, it can flare up in those individuals who already had obsessive compulsive disorder and they had frequent washing. This might be a time where there are exaggeration of those symptoms. So COVID pandemic is telling us that we should carefully look out for emergence or increase in those symptoms, and never ever hesitate to take help either through online or offline when there is something. And we should encourage people also to not to lose touch with the treating doctor. Yes.
Okay, there are two questions about vaccination. One is dealing with that you have already dealt with, but there's a specific question about uh, lactating mothers and the safety of the getting vaccination. I know that these are not specific to what Kishore talked about. He's going to talk, but just to warm up, because we have highlighted that this is an interactive session, we would like as many people to participate and raise their question. So I would allow this question. If you would wish to answer lactating mothers, and also is it safe for people with other comorbidities, etc., to get vaccinated?
I'll try to answer because Dr. Praveen Kulkarni, who is a principal investigator of vaccine, tomorrow he will be more specific. For initial information, there was some concern about lactating mothers, but of late they have revised certain strategies and they have said certain vaccines are safe for the lactating mother. That's the first answer I want to clarify. And those people who have other conditions, unless they have severe immunogenic reactions or compromised immunity, these people should always talk to their treating doctors. Personally, I know a couple of people who had anaphylactic reactions for earlier certain injections. These people have been warned that unless your vaccination is supervised, do not take it in any center where there are no facilities. So, a immunocompromised state or a severe reaction to some of the injections or medication which has been tried, just talk to your treating doctor, and there are good number of helplines available. Never hesitate. Please call up a helpline and check. And even in the vaccination center, there is a nodal officer. He's supposed to give all information for your concern. Please make an open question there also to get the right information. To my best of abilities, I think I've answered this. But please do join the webinar tomorrow. Dr. Praveen Kulkarni will also answer this. Yeah.
In fact, Dr. Praveen Kulkarni has been researching, and I heard him talk to somebody at the beginning of the seminar that he's going to start some research survey on vaccination. So please do join him tomorrow. Now, there is a real brain teaser question for you, Kishor.
Yes, sir.
This is, of course, you may or may not be able to answer, but it's a very interesting question. Sir, may I know, psychological counseling has any effect on immunity of the depressed person? Have you understood the question? Psychological counseling, will it enhance the immunity?
Yes. Yes,
Yeah.
the answer is yes. There has been numerous information and evidence based on multiple wonderful investigative strategy, including fMRI studies, that therapy does act as a booster for increasing the immunity. We need to understand that the mind is a dynamic system. It interacts with the environment. It interacts with the internal system. So if it receives lot of positive things from the external world through therapy, it definitely boosts. So there is a lot of evidence. The answer is yes. Uh, it boosts the immunity, but not everybody should consider it as a uh, let's say something which hinders their ability to take help. So if you have really a problem, don't just wait for certain kind of things to come from outside and boost your immunity. Please go and take help also.
There's a general question again. How to motivate health staff to work with COVID patients? And one is very specifically, why are our doctors and others not concerned about the safety of nurses? And how to encourage nurses to work in COVID ward? These are general questions, but since this is the first session, I thought I will allow all these questions so that people get warmed up. Okay, go on, Kishore.
Because we had our director here, Dr. Dayananda, he would have told us how we have been encouraging the nurses and others to do it. Some of the strategies is about human values. Those people who seem to feel that it is a service to the mankind, who feel that they are offering service to the neighbors and the family and the patient as their own. In many religions, it is considered norm to provide the service, and this is some of the ways we need to encourage more and more healthcare professional to use it. But to be very specific, if you have a person who is hesitant to do service, just spend couple of minutes to understand what the concern of that person is, why the person is not ready to do service in the COVID. There might be genuine concern about that individual. A, a blanket approach may not be helpful, but a personalized interaction can greatly benefit a person's ability to join and work during the times of disaster. I think I have answered first part of the question, but I can't remember the second part, sir. Have I missed?
No, no, that's fine. So I think with one or two more questions, I'll wind up the discussion and we'll go on. The people have made comments. One comment is that the governmental response to dealing with the COVID problem has been disastrous. Then some others have asked whether the material that you presented today would be available to people, particularly slides. And one of them, because his internet connection was faulty, he missed a little bit. And I think it would be made available later on. But the organizers would tell you about that. I have. Then there's a last question, and I think then after that you can go on. This is a very specific question uh, by a student. He is saying that he is attending online classes most of the time and not getting adequate clinical skills. So how will this affect his overall clinical skill development? Our Pro Vice Chancellor also referred to various kinds of fears which people have. So do you like to respond to this question?
Yeah, I would like to respond. There are many innovations happening in the way we are doing teaching learning through online and also in a safe environment. If you are a medical student, I hope you know that there is something called a simulation center in each medical college. Simulation center is a center where there are no humans but highly programmed mannequins which are near normal to your understanding and developing real skills. I think in the next 2 or 3 years, there will be extensive use of these things. But alternatively, one of the paper we are presenting is that if you want to learn the normal, let's say auscultation, percussion, or this, start with your family members wherever you are. So let's say you want to learn how to do auscultation of heart. You can start with your father or your brother and check how do you go with that. So when we talk about skills, this is the first phase we have to do. But pandemic, I think it will give lot of scope for you to learn from alternative ways. We agree that there is an impairment, but I don't think it will be so difficult for you to learn skill as long as you have real interest. And in medical colleges, it is much easier once you are back in a safe environment where most people are vaccinated. You will continue to see them and learn your skills. I hope I have answered that, sir.
Okay. I think we will now wind up the discussion now and we'll let Kishore present the second part. But let me tell you, there are some more questions. I want to compliment all the people who have asked questions. Even after the following lectures, please feel free to just type in the chat box or the question box any concern that you have. The number of questions which we have not specifically answered will get answered if you patiently listen to lecture number 2, lecture number 3, and the 2 other lectures tomorrow. So this is a whole module. Kishore has only just begun. Please remember that the module gets completed when you listen to all the 5 people. So many of the unanswered questions will get completely answered, but please don't hesitate to write the questions after every lecture. Now, before I hand over to Kishore to complete, I wanted to say it at the beginning because our Pro Vice Chancellor was making many comments about the COVID batches and all that. And I'm reminded because this person who asked the question is worried about his future. How much of his clinical skills will be lost on online classes. So the COVID batches are already becoming popular. Pro Vice Chancellor mentioned that somebody doesn't want to recruit if you're passed out during this period. I saw something which was sent to me this morning. It's about one man who is asking a student, do you know what the Newton's second law is? So the student looks back and says, I'm not a law student, I'm a science student. So this man thinks, oh, maybe he's a COVID batch. I don't know whether you caught it. Somebody asks a student, do you know Newton's second law? And the student answers, no, I'm not a law student. I'm a science student. So this man wonders, oh, maybe he is a COVID batch student who has learned online. This is making fun of COVID batches. I am not trivializing it at all. I think all universities are doing the best thing. Now back to you, Kishore, for the next part of your lecture.
Yeah, because of short of time, I'll just finish one or two cases which will be of interest to the all people. So now this is about a 40-year-old gentleman who is an electrician And in a small town, he was accompanied by two of his friends who presented in the first wave of lockdown in 2020 June with complaints of increasing fear of being affected with COVID-19. This person stopped touching anything at home. It became very distressing for the family because he refused to touch anything at home, felt that anything can turn out to be COVID 19. He stopped interacting with the friends. He spent most of the time watching at the news channels, hours and hours together about what might happen. Repeated physician consultation was taken. He had no illness, never met anybody with COVID 19, but he suffered so much. He did not have any medical or psychiatric condition. So this is something which still we hear about, people becoming extremely fearful, refusing to touch, refusing to interact, refusing to meet their friends or family members. And this how were some of the cases which might come. I want to talk about another Mrs. G. She's a diabetic and she was a primary contact with COVID 19. She developed fever with near normal oxygen, admitted to COVID ward. She was shifted to ICU with fluctuating sugar levels. There were a lot of monitors which keeps beeping, talking, giving the pulse, blood pressure, and other things which were disturbing. Lot of sleep problem. She recovered well, but she never had a good sleep after her recovery. She felt very tired and she break down easily and she would cry off. So this is how a person who has been affected and then finds it extremely difficult to sleep and develops sadness over a period of time. Then this is another lady who is 38 who came to us from a rural area. What happened in her village was her there were 40 houses in the villages and people because of COVID-19 had put up a fence everywhere, and even a small road was fenced which was very difficult for people to commute. Couple of days back, what she tried was she wanted to cross the fence, so she just lifted the fence and moved across, and this made the villagers very angry. They scolded her. They called a panchayat meeting, and husband was called and he was asked to apologize for not following the rules of COVID infection. The husband was very humiliated. He scolded the patient, and what happened is that same night, distress she committed, attempted on life. Now, what stigma can do, it can break our ability to conventionally look at who are risk for suicide, which we reported and it came in press and media. This is about another person, Mrs. J. The person was in first year professional course. She returned to her family due to lockdown. She makes emergency calls to convey her life at family has been very distressing. There are constant fights among the parents at home. She began to feel it is impossible to stay with family, dejected with life. All the time she's been thinking about committing suicide. So, how the lockdown seemed to exaggerate conditions at home and how people start to feel that it is better to die. These are some of the facets of cases which have come across. And Mrs. R, a student in health and allied science courses, calls the distress about her elder brother, who is just 28, who attempted on life using a knife. What happened is that with the onset of lockdown, for 2 weeks they had seen him to be confined to a room. He never came out even for food. They found out that this person was taking cannabis, the ganja. He had become very suspicious of all family members, and one day they saw him with a knife trying to kill himself, and this girl had to make a distress call. How substance use during the COVID time can create emergency. Now, this is about the issue about an agriculturist who came to us about a couple of months back to emergency with shaking of hands, sadness, and hearing of voices. The spouse said that he had incurred about 1 lakh loss because he could not sell any of his harvest in the lockdown period. Patient already had 4 lakhs loan. This person would buy the seeds and try to pick the harvest, but there was nobody to buy, and no alcohol was present available for initial couple of months. And once it opened, this person started to drink alcohol with taking loans. And this gentleman started to feel that there are some people who are trying to kill him. He could hear voices, and when he came here, he had already attempted on life earlier. Incidentally, this person also had a family history of suicide. So, how economic loss and family history of suicide can worsen during this period? This is another lady, another person, 36 year, a single who lives with his father. The father developed cough without fever. RT-PCR was done. It was negative. Neighbors began inquiring about his father's health. Even though he conveyed that his father had no COVID-19, people around his neighbor and surrounding people suspected. He felt very distressed. He began to suspect there is a conspiracy to harm him and his father. He started to quarrel with all his neighbors. Long back, he had previous admission for nearly 1 year. He was doing well, and the COVID and the stigma, and even when symptoms are not associated with COVID, the way people are perceived can be a serious risk factor for those who already have a condition. These are a couple of cases I wanted to highlight, and with this, I would like to conclude and my part of the presentation because we are running short of time. If there are any question, we can take up. Sir, over to you.
Thank you, Kishore. We have had an extensive discussion. In fact, we took up all the questions which came up. There were only few other comments. One comment which we have not taken up, which will come up as we go along, is can people who have allergy get vaccinated? But we are not going. I'm not going to request you to answer that. Then there's another person who has mentioned that interns and medical students are also already beginning to get the burnout. Okay, that's fine. So I want to thank Kishore for a very illuminating beginning for this session. He has given the broad canvas of disasters, disaster-related problems, mental health problems. Now, in the succeeding lectures, we'll be coming to the more specifics. And he has also given us a flavor of how these things present. What comes to the clinic in JSS Medical College or in any other medical college are only the most severe cases. In the community, there are a larger number of people who may have milder problems. And you as facilitators, you have a responsibility once you finish all this course to identify them and advise them. So the cases that you presented, the 6 or 7 cases are real cases. Thank you very much, Kishore, for a very good presentation.